Have you been told that you've got pre-diabetes or glucose intolerance and wanted to know what does it mean and what are the ways that you could actually improve your life and basically not progress to diabetes type 2? So you've come to the right place, and what I try to do is to give you some top tips that you could use actually to avoid being transformed into a proper diabetic patient and basically to avoid pre-diabetes if that's something you want to learn about. For those who don't know me, my name is Dr. Shoaib and I'm one of the medical nephrology registrars at Cambridge University Hospital. Before we get to know more about pre-diabetes and glucose intolerance, do not forget to press that subscribe button and that little bell icon down there so that you can stay updated. So the term glucose intolerance or impaired glucose tolerance or pre-diabetes essentially more or less mean the same, while the term specifically impaired glucose tolerance is an umbrella term and it encompasses a lot of reasons and causes which could cause someone's blood sugars to be out of control. Pre-diabetes is usually used if someone's got a risk factor that they can end up being a type 2 diabetic more specifically. So some of the causes that could cause someone to have impaired glucose tolerance, they do include genetic or hereditary conditions. Medications for that matter can cause that as well. And in some patients, autoimmune conditions, infections, they could cause someone to have impaired glucose tolerance. So how would you know that you've got pre-diabetes or impaired glucose tolerance? So how do these patients present? So usually the most common symptoms do include passing a lot of urine. We call it polyuria. And that basically is because they've got a lot of sugar in their blood, which basically needs to be gotten rid of. And by producing more urine, that's how the body tries to cope up and lose that extra amount of sugar. So they have polyuria. They subsequently have a lot of thirst, so they want to drink more. There is itchiness sometimes that could happen as well. Dry skin is another symptom that could actually happen if the patients become too dry. Infections can sometimes happen as well, which is because they pass a lot of glucose in their urine. So that makes them that much more exposed to urine infections. So that is one of the other symptoms that they can have. Anxiety and anxiousness is a very common symptom, and this is understandable in young patients specifically. But then as a result of that, catecholamines are released. These are hormones in the blood, which by themselves they cause more sugar levels to be increased in the body, and this vicious cycle keeps continuing. Now, one of the common questions that is being asked is pre-diabetes curable? So yes, it is curable or can be curable, especially if there are causes which are reversible, like someone having pre-diabetes because of certain medications, infections, and even for that matter, certain autoimmune conditions are treatable. So once that is sorted, the condition basically reverses altogether. One of the common questions is what kind of medications can cause impaired glucose tolerance? So some of the most common culprits, they include steroids for sure, if someone's using them for another condition or if someone's using them for contraception, sex hormones. So they come in all sorts of flavors. Apart from that, we've got beta blockers, and they are specifically used to control blood pressure, but they can cause sugar levels to go up as well and end up causing someone to have impaired glucose tolerance. Diuretics can sometimes cause impaired glucose tolerance, and these are the drugs that are used to increase someone's urination frequency or amount for that matter. So how do you treat impaired glucose tolerance? So common misconception is that you need insulin or you need medications. You definitely don't need those because this is the initial stage, and this actually is the stage which subsequently progresses to type 2 diabetes. So in this initial phase, most of the times you don't need medications. All you need are some basic tips and conservative measures that you need to take. So here are top 10 tips that you could use to improve your insulin sensitivity and then subsequently help with your pre-diabetes or glucose intolerance. Number 1, improve your sleep time. So try to get at least 8 hours of sleep in 24-hour period, and that's going to help with your health in general as well. Number 2, exercise, and try to exercise more. So usually I think it's ideal if you can get at least 40 to 50 minutes of exercise every day for at least 5 days a week, and that's basically going to be a minimum thing that you should try to achieve. Number 3, try to reduce stress. So the more stress you take, the more catecholamines will go high in your blood, and subsequently you'll have a lot of sugar in your blood. Number 4, try to lose a few pounds. Now, this is more or less the same as exercising more, but it's more important because you could achieve the same target by basically trying to control the type of food that you eat. So cutting down on high sugar, high carb food is going to be one of the main things that is going to help you with your weight. Number 5, try to eat more soluble fiber. So fiber in the form of psyllium, husk, they are some of the ideal forms of fiber that you could try to use or incorporate in your daily diet. And they are going to help fill you up early and also with your glucose intolerance. Number 6, add more color to your daily diet. And by that I mean introduce more fruits to your daily diet. Fruit like apple, which contain a lot of fiber, are going to be extremely helpful in this regard. Number 7, introduce more green as well. And by that I mean introduce more green vegetables. So you're not going to avoid carbohydrates all the time. So it's better to take the good kind of carbohydrates. So vegetables are definitely one of those. Number 8, cut down your carbs. I think it would have already come across in my tips already. But I guess the idea is to try to avoid any food item which provides you with cheap carbohydrate energy, which by that I mean trying to avoid all the sugar-rich food or soda or drinks that you usually or normally would consume. But in this case, avoiding them is definitely going to help with your impaired glucose tolerance. Number 9, keep yourself well hydrated. So drinking at least 6 to 8 glasses of water every day is essential. And how it works is basically it makes you a lot more filled, so you eat less. But more importantly, it allows your body to get rid of that extra sugar. And that's how basically it gets rid of those extra carbohydrates from your body. So try to drink more as it's going to help you as well. And number 10, cut down on your smoking and alcohol. So it goes without saying that the more alcohol you consume. Number 10, cut down your smoking and alcohol. Alcohol by itself can increase or elevate your sugar levels in the blood. And by that, basically, it asks your pancreas to work more and more. So the idea is to minimize the stress so that your sugar levels remain under control. And one extra tip from my side to you, try to incorporate green tea into your daily life routine. As it's been proven by research to have a positive effect on your glucose control. So green tea is the way to go. So there you go. These are your top 10 tips which could actually help you. And these are all scientifically proven and backed by research and currently in practice in NHS hospitals. If you've got any more questions, please do feel free to ask them in the comment section and I'll try my best to answer. Before I leave you, a quick request. Please press the subscribe button and that bell icon down there so that you can stay updated. And that's it from me today. Until next time, take care of yourself. Allah Hafiz.